In this video, we're going to cover nasogastric tube insertion, and nasogastric tube discontinuation will be in a short video following this one. So to begin with, when you have a patient that needs a nasogastric tube, you have to have a doctor's order. So I have a doctor's order here that says to insert a nasogastric tube to low intermittent suction for Punky Brewster. That is set at 80 to 120 millimeters of mercury for the suction, and that's something we will check when we get into the room. In addition, for our supplies, we will need a Salem sump tube, and it looks like that. And this usually comes in a package, but this is your 60 milliliter catheter tip syringe. You will need one of those. You will need some KY jelly lubricant. You'll need a rubber band and a safety pin. You'll need some tape, and you will need some pH strips. With all that, we want to take at least a copy of our doctor's order to the room to verify the patient. And we're ready to go to the room. Okay?
Come in.
Hi, my name is Debbie. I'm going to be your nurse today, and I have a doctor's order here to insert a nasogastric tube to suction. Have you ever had an NG tube before?
No, I haven't. I'm pretty nervous about it.
Okay, well, it's okay. I understand that. It won't be painful. It may be a little uncomfortable, but I'm going to talk you through the whole procedure as we go, okay? How are you feeling today?
I mean, I'm okay other than having some nausea.
Some nausea? Okay. This will actually help with your nausea, hopefully. It'll just decompress your stomach and help you so that you don't feel that way as much, okay? So we have everything ready, but before I get started, I'm just going to wash my hands. And I'm going to ask you if you could please tell me your name and your date of birth.
Punky Brewster, 2/23/1953.
Great. Okay. Have you ever had any type of nasal surgery, or do you have any polyps in your nose? Anything that would keep us from putting an NG tube in either side?
No.
Okay. I'm going to ask you to breathe in on each side for me. Make sure it's clear. Does that feel pretty clear through each side?
Yes.
Okay, great. I'm just going to take a minute to check a couple things. So I'm going to check my suction first. So on the suction, you will notice there's 3 different places you can put it. You can put it to the off position. You can put it to regular suction. It just says it on the top here, and it says it here too. Or you can put it to intermittent. That's the INT, and that's what we have the order for. So then we put it to the INT and we take the dial, and on this is fake, so it's not going to really go up to where it needs to be, but in real life you would put it up to where it needs to be, and we want it to be between 80 and 120. So it's going to be in this little yellow zone here. So we got it all the way up there. We'll just say we have it all the way in the yellow zone, and we want to check the suction to make sure that we feel suction there. If you don't have a feeling of suction, there's a problem with the canister having a leak somewhere. So you're going to have to make sure that this is secure. The lid should be secure on the canister. This is where all of the contents will go, and everything's hooked up correctly. You want to have this done ahead of time so that when you get ready and you need it, it's all ready to go. So we have that ready to go, and we want to get our gloves. Ready? I'm just going to listen to your bowel sounds to see what I hear as a baseline before we get started, okay? Okay. Now, sometimes people do feel a little bit nauseated during this, and if you do feel like you're going to vomit, I do have a little basin here, but it's pretty quick, so you shouldn't have any problems. But if you do, that's right here. I'm also going to give you some water with a straw, and how we do it is each time I push the tube a little bit, I'm going to ask you to sip and swallow, so that you can literally swallow the tube down into your stomach, okay? I'm gonna put that right there for you so you can grab that when we get ready. And I'm gonna get my towel. Basin. And here's, I'll give you a tissue too in case you need that when we get done. It can make your eyes water a little bit sometimes. Okay. So now I'm gonna just prepare my supplies like I need them, I'm going to tear 2 different pieces of tape. This piece is going to be to mark the tube. So this little piece, that's all I need for that. And this is going to be to secure the tube to the nose. So I'm going to want it a little bit longer. And I'm going to want to make some what we call legs on the tape to wrap around the tube. So I've got this piece to go on the bridge of the nose, and then I've got the legs to wrap around the tube. So I'll have that right there. I'll put it a little closer to me on that one. Okay. Open my tube. This is not a sterile procedure, so I can literally touch this as long as my hands are clean, and as long as my surface is clean, I can lay it down on things, okay? You'll notice it does have a blue piece of the tube, and then it also has just the regular part of the tube, and there's little markings on here, okay? You can see that it goes from 10, and you see little markings that goes all the way up to, this is at 80. So these are in centimeters, okay? That's how we're gonna know how far to put the tube down, okay? The blue piece is your air vent. So when you get the tube placed and hooked to suction, you'll want this open because this helps vent to help it suction better. This is just a little adapter. It comes out. You will need this to hook it up to suction, but it comes with the tube, okay? For the time we're putting the tube in, we're gonna go ahead and keep this connected to the air vent so that as stomach contents come out, they won't spill out all over the bed. So we'll have it contained there, okay? You do wanna make sure you measure the tube. That's the first thing you wanna do. So with this, I'm gonna go from the earlobe to the tip of the nose to the xiphoid process. So we're just approximating how far to put the tube down. Take our piece of tape we had ready, and we'll just wrap it around there. And this is one way to mark the tube. You could also document where the tube is once you get it down with your markings on the side. This is going to become important later if the tube had slipped out or something, to know exactly how far down the tube was supposed to be, okay? All right, so I'm going to open my lubricant, and I'm just going to put the tube right into this lubricant to get it good and lubricated. All right. All right, so what we're gonna do, Miss Brewster, is we're gonna sit you really high up. Like if the head of your bed's gonna be really high up, it helps the tube go down better. And then we're gonna also ask you to put your chin down to your chest. So just to make it a little easier, I'm gonna remove this like that, and then when we get ready, I'll just have you put your chin to your chest as we're putting it down, okay? Okay. How are you feeling? You feeling okay?
I'm just nervous.
Okay. All right, so ready? We're gonna put you way high up. It's gonna almost feel like you're sitting straight up. Section ready. Just gonna put it right over here so it's all ready to go. All right, you have your cup of water ready. So whenever I say, I want you to just sip and swallow, sip and swallow, okay?
Okay.
All right. Here we go. Chin to chest. All ready? Take a sip and swallow. Sip and swallow. Sip and swallow. Sip, swallow. Sip, swallow. Okay, great. We got it right there where we need it. Okay, and before I do anything else, I'm going to go ahead and secure this down so nothing slips out. So you're always going to want to use 2 hands to keep your tube secure. I have my little legs here, and it can be kind of tricky working with tape and gloves. Just something that you have to learn to do over time. You're just going to wrap one leg around the tube like that to secure it, and you'll take the other side and wrap it around the tube to secure it better. And that's usually a good security for your tube. There are facilities that make equipment to help secure the tube where you don't use the tape, but this is a good way to do it when you don't have that. How are you feeling now?
Oh, I'm okay. My throat's just a little scratchy.
Yeah, that's normal. You're going to have some scratchiness. Wasn't too bad though, right? Okay, so we're going to go ahead and check our placement first. We got our suction ready. So I'm going to remove this, but when I do that, I want to pinch the tube, because if I don't pinch the tube, remember there's probably a lot of stomach contents in here. So I want to pinch it first like this, and then grab it with this hand. And then I'm just going to take it like this, put my syringe on here. I'm going to pull back, and I don't need a lot of contents, just a little. And I'm going to get my pH, and you can just put it in the basin to check it. And you just take the contents and put those stomach contents right on your little piece of strip. Okay. Wait until manufacturer says, and then check it. And there's usually a little graph on the side to see what the pH is. So the pH should be, from our reading, between 1 and 4, and that tells us that it is in the stomach. Okay. The gold standard is going to be your chest, your x-ray. So your x-ray will tell for sure it's in the stomach, but if that's not done, and even before you get the x-ray, you can check placement with pH and be pretty sure it's in the stomach. Okay, now I can just go ahead and hook it to suction. Again, you want to pinch the tube, disconnect here. You're going to need the adapter here. Remember, this is your air vent. And I'm just going to hook it up to my suction. And I should hear suction. More than likely, you're going to see contents going into the tube. So you'll know for sure that you do have stomach contents and you're in the right place that way. Okay, so we're ready to get all cleaned up. How are you feeling? You okay now?
A little better.
Notice a little bit better? Great. Okay, I'm going to wash my hands. And then I'll just clean my area up, restore the room. I'm gonna put you down just here a little bit. We need to keep the head of the bed at about 30 degrees anytime there is an NG tube in place. I'm gonna put the pillow back underneath your head here. Your call light is right here, so if you need me, you'll just push the call light. I'm gonna go ahead and secure the tube with the rubber band and the safety pin. And you just wrap the rubber band around the tube like this, and then you just secure it to the gown. That's just to give it flexibility and keep it in place. All right, I'm gonna lower the bed all the way. And I'll be back to check on you. Just give me a call if you need anything, okay?
Okay.